This is the Gum Guru with Dr. Macon Singletary from North Raleigh Periodontics. This is a show about keeping your teeth and gums healthy and how a healthy smile affects your overall health. Today's episode is called 3 Ways to Treat Dental Anxiety. Why going to the dentist isn't as scary as you think.
Welcome to the Gum Guru podcast with Dr. Macon Singletary. I'm Jason Kong, and as you just heard, we are going to be talking about dental anxiety, the fear of going to the dentist, and why it really isn't as scary as a lot of us kind of make this out in our heads to be. And Dr. Singletary, thank you so much as always for being here. This wouldn't be much of a show without you. I mean, if it were just me talking about this would not go very well. But this is a real thing, fear of the dentist. And, you know, what's interesting to me is that I've got a professional here in the room with me who had a major fear of going to the dentist.
Oh, yeah, definitely. Thank you, Jason. Yeah, it's definitely will affect people, you know, going to a healthcare provider, whether it's a physician or dentist or whatever. But, yeah, my first experience with going to the dentist was 8 years of age. A family friend, nicotine-stained fingers with a Coca-Cola sitting by the bracket table. And it was an interesting experience. And it's unfortunate, but at an early age, you can set up a pattern or thought of that experience. That first experience, no matter what it is important. And they teach this in dental schools now, how to handle young patients, so then when they become adults, they don't have that fear. But I see mostly adults, and so they've already got that pattern of fear, most of them, and rightfully so.
Yeah, and that's got to be kind of challenging for you because, look, I've been doing this show with you for several months now, and I can tell you've got a great bedside manner as a professional, and you're very comforting, but it's hard to convey that to someone who's not in the room with you, and those are the people who probably need to see you the most, those who have avoided going to the dentist because of this fear. So how do we overcome that? How do we take that first step?
Well, knowledge is one thing. It's important to surround yourself with people. You know, before an individual sees me, they'll call the office, and if you got Attila the Hun or Groucho Marx answering the phone, and that's going to set up apprehension already. You want somebody on that phone that's got a smile on their face when they call you. But knowledge is important, and if I can get a person through the front door, I will explain to them what we're going to do before I do anything. And it's always good to ask, if you're apprehensive, to express that to your dentist, periodontist, or your healthcare provider. Generally, dentists get a bad rap because we inflict bodily harm. We got that needle, and that's a scary thought. And just usually, you coming in, there's pain, that may get you through the front door to begin with, because if it doesn't hurt, what are you going to do? Just leave it alone. Ignorance is not bliss. So the first thing is to really, when you're not in pain, is to go in to see your provider, your dentist, and to see what might be going on, and he'll do an exam on you. And generally, when I do an exam, I explain before I do anything what I'm going to do. And I try to make light of it. I do talk about my experience. When I was 8, the dentist comes in and takes out that little medieval torture device you check for decay with. That hadn't changed over 400 years. I think they used it in the Spanish Inquisition. And they check for decay, and it might hurt. And so before you do anything, I'm going to do this, and it might be uncomfortable. I use a probe to evaluate the periodontal health around the teeth, and I'm going to be gentle. I tell patients I don't do this to see how far you jump out of the chair, or there are no claw marks on the ceiling. Raise your left hand if I'm uncomfortable. And so I try to establish the fact that I'm listening to them, and then I understand their fears to begin with, because I'll ask them questions about their medical history, and almost the majority of the time a patient will express, I don't want to be here. I'm definitely afraid of dentists. They'll express that right to beginning. Those are the kind of people that I can help overcome. It's the ones that are real quiet, that don't say, I don't want to be here, or I have a fear of dentists. If there's a fear, express it to the provider and say, hey, I don't want to be here. Or I'm afraid of pain. And I usually tell patients, I am too. I'm in the no pain, no gain group. I'm in the no pain, no pain group. I had a gym teacher when I was in high school that I played basketball, and if we lost a game, we had to run rinse sprints it seemed like for hours. And his motto is no pain, no gain. I'm going, okay, I'm not going to, that's, no pain's no pain. So, I try to tell the patient, if you're uncomfortable, let me know, raise your left hand. And if you see me in the grocery store and raise your left hand, you're going to make me feel bad. But and that happens every once in a while. But yeah, so knowledge, and then once a diagnosis is done, what do we do? And what's the game plan? And there are ways to make a patient comfortable when we have to do a procedure. And they're like 4 levels, so to speak. The first level is topical, and that's a cream that you place on, and it tastes sort of yucky. But the worse it tastes, the better it works. If it tastes good, it's not going to be as effective. But so you put the topical on, numbs things up, and so that's the first level. And if we're doing some things that involve like deep scaling or I'm doing a procedure, extracting a tooth, then we use an anesthetic, a local anesthetic. And, showing a patient your equipment, that can create fear too. When I was 8, and the guy hit the decay and said, "Oh, you have decay." And I said, "Yeah, that hurt." He turns around and he's fumbling around in this ugly green cabinet with the porcelain trays and pulls out this thing you put in horses and said, "Do you want this?" You don't show an 8-year-old the syringe. I said, "No, you're not going to put that in my mouth. That's for horses," quote unquote. I got out of the chair and ran. I got in the car, locked the door, and my mother comes out and knocking on and said, "What are you doing?" I'm not going in there. It took 3 of them to hold me down. So you got to be aware of, the provider needs to be aware of the presentation and have empathy. So if the provider doesn't have empathy. Yeah, get a second opinion, because you want somebody that is not going to just do the procedure right off the bat. And if he's doing it real quick, that's a problem. You communicate, ask questions, get the information. You have a local, you have the topical local. You do nitrous oxide, which can nitrous oxide is great. It's instantaneous. If you can breathe through your nose, it doesn't have any side effects. You can drive in, drive out. I've never had any problem. I have a problem with nitrous oxide. And you can do by mouth medication. And the last resort, if you're doing a major procedure that is going to take a long time, you could do IV sedation. But generally, by mouth and nitrous can handle it. IV sedation is fine. It's just it ups the peripheral problems, like you can't drive home afterwards. You can get phlebitis in the vein. You have to be accredited to do IV sedation. It's an upper level a service provided for a patient, but the dentist or oral surgeon or periodontist that does it has to have special credentials to do it. And rightfully so. You're putting a patient under so that we can do light sedation if it's a major procedure. That requires equipment that is monitored, and you have to be real aware of what's going on. But you have to be accredited. But there are ways of doing it.
There certainly are, and there's a lot of options, and there's varying degrees, as you just outlined, for those who maybe do have that fear and would like some options to help alleviate that a little bit. Dr. Singletary, can you talk a little bit about maybe 1 or 2 patients that come to your mind who, showed up on that first day and you could tell that they were really fearful, and then maybe they were able to experience one of these options and their feelings afterward, maybe how they have changed?
Yeah, the main thing is when a person comes in is talking to them. And as they communicate, I do a psychological profile when a patient comes in mentally. I'm doing it. My staff knows what it is. It's an acronym, HIPPE, H-I-P-E. Hysterical, indifferent, philosophical, exacting. And it helps us understand that if a person comes in, they're really apprehensive, we sort of step back. And we've had a couple of patients that are like that. A couple recently, knew an individual from Durham that I grew up with, and she knew me, and that helped, but also understanding that the first order of business is identify what your problem is. Honing on that one thing that the patient's interested in, taking care of, and everything else may look, okay, gosh, we got to handle this first. That helps the patient get your confidence, that you're listening to them. And so that individual, once I was able to do that, I mean, she had some medical issues as well, and we identify that and say, okay, we understand where you are with this. This is how we address that. So knowledge, understanding the patient's need or desire, and their need may be different. It's a demand, this is what I want, and address that. And then once you do that, most of the time the patients are fine. I've only had one patient in my years of practice that I felt like the patient came in, and it may have been a communication issue. She was from Nigeria, and her daughter came. We communicated. We did great. Everything was good. The patient seemed calm. And I came in to do the procedure, and it was going to be some extractions and some bone grafting, and put the topical on. It was fine. And again, vision is a visual action. You're looking at a forceps, looking at the syringe, can cause patients to freak out. And I usually come in low and just don't let them see it. But she saw the syringe and she just stopped, and she grabbed my hand and said no. And I said okay. I put it down. I was talking to her, and this individual just would not let me do anything. And that person needs to be put under, have IV sedation. It wasn't going to work. But the other patients that I've seen, even 2 or 3 recently, they did. Once I talked to them, got them under control, let them know what we're doing, understood their medical history and their need, met their need first, and we're moving on doing complicated procedures, and she's fine.
Yeah, and I have a lot of sympathy for those patients because she's in the office with you. She knows that this is something that needs to be taken care of, but there's just something that kind of goes off in your brain that says, oh, I can't do this. Yep. And that's where knowing that the different levels and the different options are available to you to help alleviate you of that anxiety or to help you get over that fear are available.
Right. Communication's big.
Yeah. For sure, for sure. Well, now that we know that there are ways to help alleviate that anxiety and that the dentist isn't as scary as we think, what are some action steps that we could take to help overcome this fear?
Well, first of all, realize that if it hurts, it's like high blood pressure and glaucoma. It's curtains. It's too late. Don't wait till it hurts. Go in and call an office. Ask friends who they go to. As a periodontist, I will sometimes get second opinions, or it could be they will evaluate my webpage or Google search. But knowing the provider to begin with, that helps. And when you call the office, the demeanor of the office. I mean, first of all, I really think that in healthcare, it's a travesty that when you call a healthcare provider, you get a machine, you get a recording, and you go through several prompts. And that's the way it is this day and age. But if you get a human being and they sound like they're a nice person, and that's a check right there. And your apprehension may be addressed when you walk in the front door, and you'll look at the person and say, okay, then the next step is know the provider. Always, if you have friends who've gone to dentists or periodontists, oral surgeons, whatever, ask, do you know this person? Maybe find out from friends who they go to. But yeah, and then just identify within your own self, why, what makes me nervous, and communicate that with the dentist.
Those are wonderful, wonderful suggestions and steps that we can all take to help build that trust level with our providers. So let's all make sure that we're taking those steps, and that if we are experiencing fear, or maybe we've put off some visits, let's take a step in the right direction and make sure that we can find someone that we do have trust in, and realize that this isn't as scary as we may be making it out in our minds. Well, we are out of time for today. We hope you will join us again next time. Thank you so much for listening to the Gum Guru Podcast.
Don't let dental anxiety keep you from getting the oral hygiene and dental care you need. Make your appointment today, no matter how long it's been since your last appointment. Check out Dr. Singletary's website at northraleighperio.com. If you have other questions you'd like answered on the Gum Guru podcast, send them to contact@northraleighperio.com.